Okay, it is 3 o'clock. We're going to try to pack a lot into this webinar, so we're going to get started right on the dot. I will just talk a little bit about how we're going to run things today and introduce myself. I'm David Dodge. I'm the executive editor of Gays with Kids. So you may know us from our Instagram account, which features very inspiring photos and stories of gay, bi, and trans men on their path to fatherhood. Or you may know us from our website, which has a bunch of other resources and different things that kind of touch on the lives of queer fatherhood. So we got started about 6 years ago by a gay couple who were fathers, and were finding that there was a really lack of resources to help queer men on their journey to become fathers. Because as I don't need to tell anyone on this webinar, the paths available to us are often very complicated. Surrogacy and IVF being one of the main ones, which is what today's webinar is going to be touching on. So we, over the last several years, have had a lot of people in our community, as it's continued to grow, really start to request more tailored information for how we can be pursuing these paths to fatherhood that are available to queer men, from adoption to foster care to surrogacy and IVF. So we have spent the last year really reaching out and starting to work with experts like some of the ones you're going to hear from today, so that we can make sure that we're giving the best, most accurate, most comprehensive information possible as queer men are trying to navigate each of these very complicated processes. So today's webinar is going to be focused on surrogacy and IVF. But we will have a string of other webinars coming out over the next several months focused on adoption and foster care, co-parenting situations, and everything in between. We really are trying to make sure that we are the main place that you can go to find out literally the answers to any question that you have about queer parenthood. And we're very excited to be starting this webinar series. This is just the second in our series. We're going to be rolling out tons of new resources on our website too, so I'm going to encourage you to go to check that out. It's at www.gayswithkids.com, where you can find out a ton more about each of these topics we're going to be talking about through the webinar series. So I will now just get us going. Quickly, I'm going to turn it over to our panelists in just a second. But so I want to introduce them very quickly. We have Kristen Hanson, who is the co-founder of Simple Surrogacy, with us today. We have Dr. Jerald Goldstein, who is a doctor with the Fertility Specialists of Texas. So when it gets to them, I'll let each of them talk a little bit more about who they are. But these are, again, we've been reaching out and wanting to work with the top people in the field so we can make sure that we really are bringing you the best information possible. And also players in this field that have a long track record of working with LGBTQ people, because there are a lot of options out there when you come to make these sort of decision points, but there really are the circle of people we would recommend shrinks pretty quickly when we're talking specifically about those that have the experience and expertise of working with LGBTQ people. So with that, we're just going to jump right in. And I will hand it over to Kristen Hanson.
Hi, everyone. It's nice to meet you. Thanks so much for joining us today for the webinar. So my name is Kristen Hanson, and I'm one of the founding members of Simple Surrogacy. We're a full-service surrogacy agency based in Dallas, Texas, and we were founded in 2002. We've got a really long history of working with the LGBTQ community to have families for them. And so it's been one of our founding principles to make surrogacy as simple and easy as possible for all of those families. So we are also founding members of the Men Having Babies program, and we're on their advisory panel, and we are thrilled to be partnering with Gays with Kids to help bring more options to gay families. So I'm here to talk about all the terminology at first. So when you first delve into this world, you're going to hear a lot of words that you've never heard before and that are going to be confusing. And so it's really great that there's a resource that they've got to talk about all the different words you're going to hear. First among them being the journey. I think it's a really appropriate thing that we started with journey, because this is not a simple process. This is not just, hey, click here and get a baby. It really is a journey, and you really need to partner with people who are going to be there with you through the ups and the downs that will happen during a surrogacy journey. It is never a linear process. Something will always happen that you want to be partnered with something who can guide you through. And so journey just entails the entire process from beginning to end, wherever you start. If you start with an agency, if you start with a clinic, if you try to go independent, if you've got a family member who's going to care for you as a surrogate, wherever you start, that's kind of talking about the whole process from beginning to end. You also hear the terms intended parent or intended parents all the time. That's just meaning the parents that are going to be formed by the surrogacy journey. So you enter into this and your intention is to become a parent. So you're going to be an intended parent or IP, and that's how you'll be referred to as you start this process. And then, of course, there is the surrogate or gestational carrier or surrogate carrier. There's a couple of different ways that they're referred to, and that's just the woman that's going to carry the baby for you. There's a lot of different kinds of surrogates. There are gestational carriers. There are traditional carriers, although that's less common nowadays. Altruistic surrogates. And well, I'll talk about those in a second, but lots of different kinds of surrogates. But that's just the woman who's going to carry the baby for you. A surrogacy agency that's what we are, Simple Surrogacy, and they're the people that generally oversee the whole process. I would say most people use a surrogacy agency to manage the entire process from beginning to end, just so that they have someone who handles the process for them. Think of us as a wedding planner for your baby. It's kind of the person that is the clearinghouse of all the information. Locate the surrogate for you, manage the donor if you choose a donor through their program, coordinate all the appointments with the clinics, coordinate all the legal process, coordinate with the hospital, coordinate the medical bills and the escrow. Basically the person that does everything and handles the entire process so you can just sit back and focus on having that baby. Fertility Center, again, that's Dr. Goldstein is going to talk some more about that, but that's the place that's going to actually do the creation of the baby. They're going to take the eggs, they're going to take the sperm, they're going to make them into an embryo, and then they're going to transfer that into the surrogate. At that point, the surrogate is confirmed pregnant, and then she's transferred to her regular doctor. But the Fertility Center is where all the magic happens, where they actually create the embryos and help you get pregnant. Gestational versus traditional surrogacy. So most times nowadays, you will be practicing gestational surrogacy. That is where the surrogate has no genetic relationship to the child that is born. So that's, you would find a separate egg donor, or you would have a relative maybe possibly who is going to be your donor, and the embryos would be created with the egg donor and your sperm and then transferred into the third party who is the surrogate. Gestational surrogacy is usually practiced more commonly because there is no genetic connection, so the surrogate has no legal rights at any point to the baby that is born. It's a lot safer and it's a lot legally cleaner to do it that way. Traditional surrogacy is less frequently practiced. 20 years ago when we started doing this, it was more frequent to have a traditional surrogate now and then. Traditional surrogates are genetically related to the child. So a traditional surrogate is both the egg donor or egg source and the surrogate. It does create legal complications because then she is actually the genetic mother to the child. So you usually have to sever those rights in many cases, and there have been cases where the surrogate can come back and try to claim ownership over the child. So generally, we don't recommend traditional surrogacy. Nowadays, we see traditional surrogacy being practiced if, for example, it was a family member carrying that child for you to term. That is much more common use of traditional surrogacy. And compensated versus altruistic surrogacy. Again, most surrogacies nowadays are going to be compensated. There are a few states that only allow for altruistic surrogacy. New York used to be one of them, but coming this year, they're going to now allow compensated surrogacy. So altruistic surrogacy is where the surrogate is only paid for her expenses. She is not given an actual payment for carrying the child to term. And since it's our position that she actually is doing a job, she does have requirements. There are things that she has to do, tasks that she must complete. It really, I think, is important that she be paid and be compensated for those things. So at most agencies, you're going to not find altruistic surrogates. Generally speaking, an altruistic surrogate is, again, a family member or a friend or a sister who is not being paid a salary to carry the baby, but is instead just compensated for her expenses.
Perfect. Thank you so much, Kristen. So that was obviously a very quick overview of some of the very complicated terms that you will be learning throughout your surrogacy journey. And if your head's spinning from all the jargon, you will be fluent in all these terms by the end, I promise. And also, again, we go into all of these different details in a lot more detail on our website. So I will again direct you there, gazewithkids.com, and check out our new surrogacy curriculum where we explore a lot of these topics in a lot more detail. Before I hand it off to Dr. Goldstein, I also want to just invite people as they have questions that are coming to them to use the Q&A feature that you'll see at the bottom of your screen. We will be collecting as many of these and getting through as many of these Q&A as we can towards the end of the webinar. We're hoping to leave a good 20 to 30 minutes for that. Any questions that we're unable to get to or that we are unable to answer for whatever reason, we'll make sure that we follow up with you following the webinar. And with that, I'll hand it over to Dr. Goldstein.
Well, welcome everybody. I'm Dr. Jerald Goldstein. I'm the Medical Director of Fertility Specialists of Texas. I started the practice in 2005, and we are interested and we devote our time really into building families. We have a full staff here that is specifically devoted to the complexities involved in third-party reproduction. It's a very complicated process, and a lot of times it's helpful to have staff, and we have staff that are very dedicated to making sure that you really basically hold your hand through the whole process, because it can be very complicated. There's a lot of different moving parts, and so I think that we do a good job in terms of making that process. I originally am from Dallas. I have two boys that are 14 and 15, and I think that literally I think that they have changed my life, and has made and that in itself has made me really dedicated to really allowing everybody to have the opportunity of having kids, because it's really an amazing process. Back to in terms of the slide, again, we are the fertility clinic. So we see, we're where really the magic happens. And it typically starts with seeing you in our office, whereby oftentimes, we'll have you do a semen analysis, and then we freeze the sperm. You're probably aware that this is regulated in part by the FDA, the Food and Drug Administration. So we have to do a brief physical examination, and we have to do testing, which is relatively straightforward. We have you do a semen analysis. Oftentimes it's helpful to have that done before, but it's very, very rare that there's a problem that, makes it where you're unable to use your sperm to make a baby. In terms of the, after that is done, then oftentimes, and we will, then the next part is really making embryos, and that is the part that's really done, that's done here in our office here in Dallas. And so once we have your sperm frozen, then you're basically will need to come here one time, and we have that done, and then that's taken care of. In terms of making embryos, we would introduce you. We have an in-house egg donor program, and then there are agencies that also that are egg donor agencies. And it really doesn't matter to us whether you use one of our egg donors, whether you use an egg donor from a surrogacy agency or from another third-party agency. But once you have selected that donor, then we will actually go through the process of doing the screening for the donor. They're screened extensively. They have a drug screen, a tox screen, they have psychological evaluation, and then the legal part where they understand that those eggs that are created are going to be your property once we do the retrieval. The egg donor then is placed on medications to stimulate their ovaries to produce eggs. Women typically make one egg a month, but we want them to produce multiple eggs. So they're placed on medications for about 12 days. And then once those eggs are mature, then we retrieve those eggs here in our office. And at that time, we fertilize those eggs with sperm. So one of the things that's important to know that we discussed beforehand is in terms of whether you're planning on doing joint insemination, where we use both the sperm, sperm from two dads, or whether we only use one person's sperm. But we're able to keep the embryos separated, so we know exactly whose sperm we've used to fertilize those eggs. And once we do that, they become embryos, and the embryos then grow over a 5-day period. After 5 days, then we do a biopsy where we are able to test we're able to biopsy the embryos, and we're able to send them off to a lab where we're able to see if the embryos are genetically normal. So in other words, you often hear about for example, one of the most common reasons of a miscarriage is having an embryo that's not genetically normal. And so we're able to actually test the embryos to see that they are genetically normal. In other words, they have 46 chromosomes. And with that information comes sex, for example. So we're also to know whether they're a male or a female embryos. And once we've done that, it's actually a very good place to be, because it gives for example, the surrogacy agency a time where once they know that you're on the process of creating embryos and they feel comfortable that we're in a very short amount of time going to have embryos, and they can start presenting to you candidates for to be a surrogate. And oftentimes they wait until at least you're on that process, because surrogates are really ready to carry a pregnancy, and so they want to know that it's not going to be a long period of time before we actually do that. Once we are well on the way and we've made embryos, and the next thing is actually selecting a surrogate, which is the surrogacy agency is able to. They pre-screen the surrogates, and so they oftentimes send their profile over to us to make sure we don't have any issues with them. We then actually see the surrogate in our office. And with the surrogate, we're really just interested in terms of the uterus. If the uterus is normal, they go through screening to make sure that's not an issue. And then finally, they have the legal work that's done, so where it specifies exactly how many embryos we're going to transfer, and, for example, whether termination is an option, if in the unlikely chance that were to be an issue. Then the last part, which is really the best part, is actually getting the surrogate, placing her on medication to make her uterus to be the most hospitable, the perfect time where we would do an embryo transfer, and then we would transfer 1 or 2 embryos, depending on our discussion that we would have had with you before. The embryo transfers frequently, sometimes the intended parents are here, but oftentimes our surrogate, that can be, they can do a FaceTime, or they can do a Zoom, where you can actually see us place the embryo inside the uterus. And it's really an amazing, amazing process, because after we do that, then typically 10 days later, the surrogate undergoes a blood test, and assuming that's positive, then we do an ultrasound shortly after that, and you're well on your way to making a pregnancy. So literally, and I tell people this all the time, which is quite frankly, it's still very amazing to me, is that 20 years later, that embryo is like driving down the tollway, at least here in Dallas, and it's like crazy, because it starts off as just a little ball of cells, and it's like it's really an amazing process. So that's really the process from the fertility clinic standpoint.
Fantastic. Thank you, Dr. Goldstein. And so again, I'll start to sound like a broken record, but we have a lot more of these details again on our website, gazewithkids.com. We have an entire chapter dedicated to the 3 phases of the surrogacy journey, which goes into a lot of depth on a lot of the items that Dr. Goldstein just mentioned. So we're starting to get a lot of good questions on our Q&A. Again, just for those that joined us a little later, we're going to be taking all the questions towards the end, but as you are having questions occur to you throughout these presentations, feel free to just type them in now, and we'll get to them as soon as we can. Okay, next, I'll hand it back over to Kristen.
Great. So as Dr. Goldstein said, the magic is really getting to see that embryo placed in your surrogate. But before you get there, there is a lot that has to happen to find your surrogate. And so this is what the surrogacy agency is going to concentrate on. Again, just like Dr. Goldstein said, we really like to start matching once we know you have embryos in progress. So it's going to take you a few months to create embryos. We generally recommend taking care of that process before you start to look for a surrogate. Because again, the surrogates that are coming in are really ready to go. They've got a space in their lives to be able to do this, and they really want to get the show on the road and get going right away. So once you have embryos in progress, your agency will start matching you according to the criteria you put. How simple surrogacy works is you'll fill out a long profile that's going to have all of the things that you're looking for in a surrogate, all of your likes and dislikes and a little bit about you. And then she's going to do a similar thing, although her profile is quite a bit longer because it contains all of her medical information. And so What happens at Simple Surrogacy is the surrogate will see your profile first if she meets what you're looking for. And so she's going to be seeing a few profiles at a time, so we can help you make your profile as good looking as possible so that you're an appealing choice to her. And if she likes your profile and she meets everything you're looking for, then you'll see her profile. So all surrogates go through a thorough screening before they even get to that point. It generally takes us about 6 months to thoroughly screen a surrogate candidate once they've got everything in. And that starts with the ASRM guidelines. So ASRM guidelines are just generally followed by everyone in the surrogacy and IVF world. They're going to set out guidelines on what is a healthy surrogate, ideal age ranges, which is usually between 21 and 45 years old, kind of 43 years old is really the max we actually see. And that they have a low BMI, usually 32 or lower, is generally recommended. I think ASRM guidelines are under 35. Dr. Goldstein would know for sure. And different clinics have different requirements. So depending upon the clinic that you're using, you may have more stringent requirements that may eliminate a few surrogates that another clinic may accept. So definitely we would know which clinic you're being sent your surrogate to, and so we would keep those guidelines in line when we're matching you. So on our end, even before we get to the physical screening, I know that's next on the slide, you're going to see all of the details of the surrogate collected. So on our end, the surrogate does a profile, fills out all of her medical information, and then fills out medical requests forms for all of the doctors that she's previously had. And then we request medical records directly from the physicians that she's seen for previous pregnancies and for all of her health records. Once we get all of that health information, we review it in-house. If it looks good in-house, there's no red flags there that we know that would disqualify her from being a surrogate, then we send it to a reproductive endocrinologist like Dr. Goldstein. He further checks the records and again, make sure there's something that he doesn't see there on paper that would disqualify her from being a surrogate. If she passes those 2 steps, then she's going to have an interview call with our surrogate director, who's been a surrogate 4 times previously herself. If she gets through the interview call and we like everything that she has to say, then we're going to have her go through a psychological screening with a psychiatrist that's going to check and make sure that everything is correct with her mentally. If she gets through all of those steps, then she would be presented on the profiles to be chosen as a surrogate. She's not done yet though. So after that point, when she's finally clear through all those things and you select her and say, yes, I like her, we'd like to send her to the clinic for screening, she's going to go to the clinic and someone like Dr. Goldstein will check and see her in person. He's going to do an examination there to make sure she's got, BMI requirements are met, that she has a healthy uterine cavity. And I'm sure Dr. Goldstein checks lots of things like that, but she's also going to run FDAs to make sure that she doesn't have any sexually transmitted diseases or anything that could harm the baby as they were carrying it. So those are all the really important things that happen for surrogate screening. And so she's not even clear to begin legal until she's gone through all of those steps. So as you can see, it takes a long time to make sure that someone's really qualified. And generally we see about 20% of our applicants or less get through, depending on when they're applying. So it's a really strict process to make sure that who is carrying your baby is very, very healthy. And the things that we look for when we're matching are a legal fit. So that's really important depending on what you're looking for. In Texas is a really great state for surrogacy. Both intended parents go directly on the birth certificate even before the child is born. So what that means is the gestational surrogate neither has any rights to the child. Both of your names, your name and your husband's name, or your name and your partner's name would go directly on the birth certificate when the child is born. There's no need for a secondary adoption process or co-parenting or anything like that. It depends on the state what the rules are legally for that state. And so we definitely take that into consideration when we're matching, is that the laws in the state need to match up. For example, you would not want to match with a surrogate in Arizona. That would not be good. And previous to February, you would not want to match with a surrogate in New York. So we definitely take all of those considerations into factors when we're matching you with a surrogate. Timing fit, again, yes, we're not going to start looking at matching you until you have embryos in progress, because surrogates will turn down a candidate who does not have embryos identified or a source of embryos on the way. They really just want to get going when they've decided to do this. They don't want to wait. So we don't want to match you with someone and then have an embryo issue, or if your egg donor didn't cycle through, or you didn't get the quality or gender of embryos that you were looking for and have to start again. We would really hate for you to have to have paid for screening and possibly legal and then have to rematch you. So we really like embryos to be on the way before we start doing that. And really, most important, we match for personality here, which is why we really let surrogates select first and then you select after that. The reason for that is a couple of reasons. By the time you see a profile, you know that the surrogate already likes you. And we've only sent her we've only sent her profile to you if she meets what you're looking for. So we know that on paper there's a match. But we really look closely at what you guys like to do, what you like to talk about. There's only so often you can talk about what she's craving or what she's eating during the pregnancy. And so we want you guys to have other things in common. We want you to maybe like the same television shows or also like to go hiking or whatever it is that you're into. We like to have some interest there on the surrogate side as well. And we've been very lucky to have a lot of surrogates and intended parents form lasting relationships. It's not in every case, but in a lot of cases, there are people that stay in touch for years afterwards, at least trading pictures at Christmas. So it's really important that you like your surrogate and that she likes you so that there's that trust there for your whole journey.
Awesome. Thank you, Kristen. So we're getting a lot of great questions in, so we just have a couple more slides, and then we're going to dedicate the rest of our time together to getting through as many of these questions as possible. I'll hand this back to Dr. Goldstein.
So I went over a lot of this actually in the prior slide, but basically once we end up seeing when we end up seeing you, we go through the process of, that you freeze sperm, you do your testing, and then the next thing is really creating embryos. So again, we have an in-house egg donor program. There's also agencies that we can refer you to. I always like to say that if you're looking for someone that's like 6'3" and has an SAT score of 1800, we probably don't have that person. But once you select an egg donor, then we're able to go through the process of stimulating that donor. So again, you would have had a semen analysis, which rarely is an issue, whether it's one or both of y'all. We then talk about whether we're going to be doing, again, split insemination or just inseminating all the eggs. The average number of eggs that we get from an egg donor is about 17. The range is anywhere between 15 to 35. So after we've made those decisions, then we're able to place the egg donor on, after she's gone through her screening, after the egg donor's done her legal screening, then we're able to place the egg donor on medications to stimulate her ovaries. We're able to produce eggs and then retrieve those eggs, fertilize them with your sperm. Again, it's very important to be with a center that is used to dealing with surrogates and egg donors and also gay men, because there's a lot of information other than at the time when you leave when you come for your initial evaluation, where you're going to depend on us to keep you informed in terms of what's going on. So oftentimes when your egg donor goes through and we do a retrieval, then you'll get a call back that day in terms of how many eggs we got, and then the next day in terms of fertilization, and then ultimately how many embryos are biopsied. Typically, between 5 to 8 embryos are eventually make it to day 5 where they can be biopsied, and then we get a report back about a week later in terms of in terms of the embryos, if they're chromosomally normal, as well as the sex of the embryos. And that's a very good place to be in, because at that time, then the surrogacy agency really can go full speed ahead in terms of selecting, getting you matched up with a surrogate, so we can minimize the amount of time from when you create the embryos to actually making a baby. In terms of the second part, then we're able to see the surrogate, we're able to do the screening for the surrogate, place a surrogate on the medications once she has had her legal paperwork that shows that she has been legally cleared, and we're able to transfer 1 or 2 embryos into the surrogate to make a pregnancy. The whole time period, typically is about 6 months. It can be a little bit longer if there were any hiccups in terms of on the way. I think that it's important to be with a fertility clinic and with a surrogacy agency that is very familiar with the process and are used to dealing with the issues that can come up and deal with them in a very seamless way, because that really is the difference between someone that's just doing very few cases or someone that's used to doing a lot of surrogacy and is used to the process. But again, once we transfer the embryos into the surrogate, then really 10 days later, then the surrogate has a blood test, and then about 2 or 3 weeks after that, we're able to do an ultrasound, where again, it's another time where we often do a FaceTime where you can actually, or actually if you're here in person, where you actually can see the ultrasound and see that there's a baby that has a heartbeat that comes from you, really. And it's really an amazing process. And I think at that point, your life is different, and that really makes it worth it for us and for everybody.
Fantastic. So that was a Herculean task getting through the entire surrogacy process in 30 minutes. And as we can tell from our Q&A, there's a lot of great follow-up questions. So we are going to just jump right into our Q&A, starting from the top, and we'll just go straight on down. And again, if you do not get your question answered as fully as you would like, or if we don't get to your specific question, please do email us at dads@gayswithkids.com. And we'll make sure our experts get back to you as soon as they can. So let's start with the first one. So the question is, are there any options for when surrogacy embryos are not destroyed during the surrogacy process? So I assume this means embryos that you have left over that you're not using. So I guess if we could just touch on that, Dr. Goldstein, what tends to happen with leftover embryos?
Well, so there's a couple things. That's actually a great question. And I would say that with the advent of vitrification, which is a way that we can rapidly freeze embryos, that has also allowed us to rapidly freeze eggs. So if I have a patient that is concerned about that, then we'll talk about limited fertilization. So as opposed to taking an egg donor and fertilizing all 20 of her eggs, that will fertilize 5 of the eggs. And typically it takes about 5 to 6 eggs to make one good embryo on day 5. And so we'll start off and we'll do limited fertilization, which basically minimizes the chance that you're going to have excess embryos that you're not going to use at a later time. And then and that's become very successful now with the advent of vitrification. So it really prevents the issues in terms of what you hear about clinics that have a number of embryos that are basically, that are being cryopreserved in the tank. Okay,
great. Thank you. Sam, let us know if that answered your question, or if you want to follow up, feel free to type it again. Okay, so the next is for simple surrogacy. Kristen, Aaron is wondering if you have an itemized cost sheet of how the whole of what the journey tends to cost, and it would be great if you could answer for simple and then just kind of generally for the industry as a whole. That'd be great.
Yes, definitely. We do have an itemized cost sheet. If you want to shoot us an email, we'd be happy to email that to you too. And you can also find it on our website if you just want to go to services and fees and look through it. And I would say that yes, every agency has a list of itemized cost sheets. I think you're going to see the differences between agencies are going to be, is it an all-inclusive fee sheet, or are they going to add on other items? Different agencies have different protocols. For example, they might charge more for a really concierge program, or they might charge more for international parents. So it really just depends on what you're looking for, but every agency should be able to give you a detailed list for your own personal journey. So while we have a generalized cost sheet, we are also happy to have a consultation with you and walk you through and say, okay, here's what you're looking for if you choose these factors, and here's what you're looking for if you choose these factors. Just like anything in life, surrogacy can be as expensive or as affordable as you really want it to be, depending on a lot of factors. Generally, you can't get things both cheap and fast. And excellent quality. You really kind of have to pick 2 out of those 3 is what we like to say. So if you're willing to be patient and wait for the right surrogate match for you, that might be in a more affordable state, that might be more close to your clinic, that's going to save you money in the long run. And again, like Dr. Goldstein says, if you're looking for a donor who's 6'3", who has an 1800 on her SAT scores, who's pre-med at Harvard, that's going to add to your expenses. So you really need to take into consideration, where is your surrogate located? Where is your egg donor coming from? Is it coming from a clinic? Is it a first-time donor, or is she an experienced donor? Do you really need that Harvard Med School egg donor? If you're trying to keep costs down, there are things that we can help you choose that are going to make things less expensive in the long run, while still ultimately getting you the child that you're looking for.
Fantastic. And so I will also just mention we do have an entire new webinar coming up in a couple of weeks that's going to solely focus on the cost of surrogacy. That then we'll go into breaking down what the average costs tend to be and ways that you can offset it, because as everyone probably knows, surrogacy is not the cheapest route to fatherhood for queer men. I think it averages around 135. Is that what we're putting at, Kristen? But it can reach upwards of 200,000 depending on a lot of factors that Dr.
Exactly. Yeah, I think that's a good range. We like to say between 125 to 145, again, depending upon the choices that you make as an average for a singleton pregnancy. If you're looking for twins, email me. It's a whole nother ball of wax.
And again, we will have an entire webinar dedicated just to this, and also ways that you can afford surrogacy and make it a little bit more affordable for you and your family. Okay, great. So Debbie Does Dallas asks, when creating an embryo, if our egg donor was around 35 years old, who's a family member, roughly how many embryos do you think would be created? And from that, how many do you think would be genetically normal? So this would be a slightly older surrogate. Dr. Goldstein, if you could answer that question.
Well, I think that there's a couple things to keep in mind. I always tell patients that it's quality and not quantity. So if you have someone that has, that goes through IVF and has like 8 embryos that make it to day 5, but they don't really make a pregnancy, then it really is not any better than having someone that has 3 good quality embryos that make a baby. So when you initially examine someone obviously we take a history, but we also do lab tests such as AMH tests and day 3 lab work to give us an idea of how many eggs that we're going to expect them to produce. And I think that someone that's 35, it's very difficult if you just go off of, just the age alone to say how many. There are some women that are 35 that can make 6 or 7 good quality embryos, and other patients that are 35 that have 1 or 2 embryos. But I think that that it's really difficult to say without actually seeing them. But certainly 35 is not is certainly not old in any it's certainly not old. And I think that that I would certainly expect them to have 2 or 3 good quality genetically normal embryos for someone that's 35 that has no other issues.
Fantastic. And maybe you could touch a little bit upon the idea of using an altruistic surrogate in this way and how that might differ in terms of what you can expect with a surrogate that you're going to get from a surrogacy agency who has achieved pregnancy before at least, and maybe it might be a little bit more predictable in terms of the number of embryos or the quality. Would that be true or no? Dr. Goldstein.
So that again now?
So I'm wondering if you can just touch upon the difference between using an altruistic surrogate, as this questioner is asking, like a friend or a family member, and kind of how much you can predict in terms of the number of eggs you can retrieve and the quality of the embryos compared to someone that you might get from a surrogacy agency.
Well, I think that when you talk about, we're talking about an egg donor, really. Or you're talking about a surrogate or an egg donor? Because the question. Again, so when in general, I find that when people that there are reasons why someone would want to use an egg donor, but there's also a lot of issues that make it where they may not be the most ideal candidate. And so certainly from the standpoint of egg donors are typically 21 to 29 years of age. Occasionally someone's been an egg donor and they're 32 and they want to go through like a sibling journey, so to speak, then they can go through. But typically you would hope that an egg donor would be younger. We would certainly, if they're an anonymous egg donor, it would be younger than that. And a lot of times that it's difficult to pay someone back really to be when you're asking them to be like a family member to be an egg donor. So while we certainly have done that, in general, most of the patients that go through this process use an egg donor either from a fertility clinic or from an agency. So I don't know if that answers the question, but I think that if you really are if you're saying that I definitely want this person to be an egg, to be my donor, then we would see them and evaluate them and go through the process.
Great, cool. Debbie, let us know if that answered your question. Okay, so this one is for you, Kristen. Is it difficult for the agency to find surrogates? And can you just talk, and is there a waiting list for men to find a surrogate? And you could just talk about the work you do to recruit surrogates. That'd be great.
Yes, definitely. So yes, it is difficult to find surrogates. Usually our matching times at Simple Surrogacy were kind of among some of the fastest in the industry, around 4 months. But with the pandemic, things have slowed down dramatically. And I think the reason for that is a couple of fold. First of all, a lot of these women were all of a sudden at home trying to homeschool and do their jobs. And really, who has time for anything else at that point? I myself barely had time for anything else at that point, so I can completely relate. So I think there was a big period of time there where we were all struggling to understand what the new normal was going to be and who had time for anything else other than their family. We have seen that start to ease, which is great. And the thing that is slowing us down now, just in general across the industry, is doctors' offices are just a little more thinly staffed. And so if you're requesting their medical information from past pregnancies and they're at the same time trying to juggle getting patients in, they're not going to prioritize getting your medical records to you. So we've seen girls, sometimes waiting a month to 2 months to get a response from a previous doctor's office, and we really need those records to be able to clear them. So our matching times have increased. I think it's increased across the industry and not just at Simple Surrogacy. We are seeing those kind of decrease now, and we are seeing people come in now and reapply, and we've seen a pickup in applications. But I would say there's probably about a 6-month matching time generally just at our agency, and I've heard 6 to 12 months just across the industry kind of as an average. And that's for a single transfer. If you're looking to transfer 2 embryos, I think you need to consider that it could take a year to match you, just because there are fewer clinics that are approving girls to carry a twin pregnancy, and there are fewer women willing to carry a twin pregnancy just due to the risks and the possible hospitalization. So we recruit a lot to get surrogates in here, and I think it helps too that we were founded by my partner as a surrogate, and I was a 3-time donor. So we've kind of got that perspective on the industry to try to get more applicants in. But yes, I think in general, more people are wanting to have children now. I think family becomes really important when you're trapped in your house for a few months. You realize what's really important in life. And so I think the increase in interest in surrogacy is only going to continue. I don't think it's ever going to be less. I think it's only going to get more popular.
Great. Thank you. Mm-hmm. Okay, this is a great question too. I think both of you can probably provide some perspective on. So Kyle's wondering, how does all the testing and medical process work if the surrogacy agency and fertility clinic and the intended parents happen to be in different cities or locations? So how do you manage all that? Dr. Goldstein, you want to take it first, and Kristen can add?
I think that it really, we see intended parents, locally, but most really intended parents we see are not from Texas, I would say. And it certainly is not really it requires really a one-time visit where you come and we have you cryopreserve your sperm, and then you're basically done. You meet with one of our coordinators. When it comes to, after you've done that and it comes to picking out an egg donor, it really doesn't make that much of a difference in terms of whether it's logistically easier if the egg donor is within driving distance of where we are, of where our clinic is, but it doesn't really, at the same time, we see egg donors that come from across, from different states. We see the donor one time, and then all their other testing while they're going through the process of stimulation is actually, we find clinics that are all across the country, they're able to do that. They send us the results, we make decisions, and then the egg donor comes here for their retrieval. And I would say that also holds true for surrogates. Simple, as you know, is also in Dallas, and so I would say Kristen would know certainly better than me, but most of the surrogates are here local, so we're able to see them here in Dallas, and that does make it easier. But there's also some surrogates that come from from different states, but it really doesn't make that much of a difference. I don't know, Kristen, what are your thoughts?
Yeah, I think we see people from all over, and generally speaking, I would say 90% of cases, people do not all live in the same places. A lot of our clients are, from New York, and a lot of them are from overseas. We have a lot of international people. And so in those cases, they would just come in once and go see your clinic and get all their testing done, hopefully meet the surrogate kind of at the same time, if that's possible. If that's not possible, then we have a lot, especially nowadays, a lot of Zoom meetings and a lot of Zooming into doctor's visits visits, and it's just not possible sometimes for everyone to be in the same room. And so I don't think it matters at all if you're all in the same locations. I think it does keep costs down if your surrogate and your donor live closer to the clinic, because then you're not paying for travel. So I think that's a factor to consider, but there's no need for everyone to live in the same area. And I would say most times people don't. People live from all over.
Great. Thank you both. Okay, so the next question is about the logistics involved. So this is actually similar to, let's see. Yep, and I think this was more or less answered. Whoever asked this one about physical logistics, if people need to live in the same area, let me know if that didn't meet your expectations. We can get a little bit more detail there, but it generally sounds like it's not a deal breaker, and in many cases is not the case that everyone needs to be in the same location. Okay, great. So are intended twin births common during this journey? So this is, if you're a gay couple and you're both hoping to have a biological offspring, is it common to implant 2 embryos, 1 from each? Dr. Goldstein, you want to take that first?
I would say that it is common for that to happen. That oftentimes you'll have a gay couple, you'll have both of them contribute sperm. I would say it's becoming less common in terms of transferring 2 embryos into 1 surrogate. A lot of times they may use 2 different surrogates, or one start the process, and then after they have their first child, then they do a transfer like a year later. But it certainly is a discussion that we have with the intended parents, and ultimately it's really up to their decisions. But it is harder to find surrogates that are willing to go through that. That'll go through the risk of twin pregnancy. Certainly the safest from a standpoint of safety. It is safer to a singleton pregnancy as opposed to twins.
Great. Anything you'd add, Kristen?
I would agree with that. I would say it used to be, 5 years ago, it was more common that people were asking to do that. We saw a lot of twins being born to couples, 1 from each intended father. But I think nowadays we've seen less and less clinics being willing to approve people to carry a twins pregnancy if there is anything in their background history that indicates there could be a medical issue. And so we're seeing, we have people on our staff who've carried twin pregnancies 3 and 4 times that today would not have been approved to carry a twin pregnancy just based on anything they have. So I think people are just generally being more cautious. I'm also seeing twins fees go up a lot. I've seen $15,000 being asked for a twins fee. So if you look at that and you factor into that cost, and then you factor into it's going to take you another 6 months to try to find someone not only who's willing to carry, but also who would be approved. So you're looking at a longer timeline to be matched. And then I think if you're looking at, there's a lot greater risk of bed rest. Typically we see some bed rest with a twins pregnancy. I think once you factor all of those things up, that we're seeing less people choose that option. We're seeing more people do 2 surrogacies at the same time, for which we give discounts, and I'm sure many other agencies do. And we also give a substantial discount for a sibling journey. So we're seeing more people choose that just for safety, timing, and expense reasons.
Great. Thank you both. Okay, so this was specific to, I think, what you were covering, Kristen, about the legality of the state that when you're doing the matching process. So the question is that concerning where the surrogate lives, or the intended parents, or both? And what do you kind of look at specifically in terms of the law in those states?
So it only matters where the surrogate lives. The intended parents can live anywhere. There are a couple of states where surrogacy is illegal. Michigan comes to mind. And so if the intended parents live in Michigan, we generally discourage posting on social media and really talking about it a lot and bringing it to people's attention. That being said, we have had clients from Michigan. We just say, look, technically you're not doing this process in Michigan. You're doing it in the state where your surrogate lives. We would obviously never use Michigan as a state where the surrogate lives. But generally we discourage, being flagrant about it if you live in one of those states where it's illegal, but that's becoming less and less common. So the laws that apply are where the surrogacy actually takes place, and that's the place where the surrogate lives. So for example, even if you had a couple who the intended parents lived in New York, the surrogate lived in Texas, and let's say the clinic was in California, for example, the surrogacy actually happens where the baby is born. So that would be Texas. So all of those places laws don't factor into it. It's really just where the contract is going to take place, which is where the baby is born.
Great, thank you. So another question about location. This is a specific one. So if someone has an egg donor in Kentucky, but they live in Texas, would it be ideal to have the surrogate be in Texas if possible? And how would you handle that if that specific question was raised to you, Kristen, as you're trying to navigate that?
Yes, the egg donor's location actually doesn't matter because the egg donation is going to happen at the clinic. And so, yes, we would say, yeah, come to Texas. Texas has great laws that if you already live here, then yes, I would definitely choose a Texas clinic, and I would definitely fly in your donor to do the donation and use Texas laws specifically. Kentucky, not great laws for surrogacy, and egg donation doesn't really matter because you're going to be flying her to a clinic. So it'll be the laws of where she actually has the egg retrieval that take place.
Great. Anything you'd add to that, Dr. Goldstein?
No, I mean, we see, egg donors from all different states. And so it's really not, it doesn't really make that much of a difference.
Great. Cool. So yeah, overarching thing is location doesn't matter so much, it sounds like, which is good for people to know. So the next is about cost. So this is we've covered this a little bit, but I guess because this is such a big question for anyone that's thinking about pursuing surrogacy, maybe we could do just a quick breakdown. And the specific questions here are how much an egg donor costs, what the legal expenses are, what the medical expenses are, and what a surrogate's compensation is. Kristen, do you want to take this?
Yes. So I think there's such a wide range here. It really depends. Generally, ASRM guidelines are donors are around $7,000, but that's like a first-time donor who's never had a donation before. That is just what you're paying her in compensation. That does not take into factor the cost of the medication, what you're paying the clinic for the IVF retrieval, and her expenses to go to and from the clinic. She might have lost wages. She could have dog boarding. It really is very depending upon your donor. So I would say, egg donation costs just for her expenses and her compensation, I think you should probably be somewhere around $10,000. That's not medical costs included in that. And then for surrogate, again, it widely ranges based on where she lives, how much experience she has, and if she has insurance covering the surrogacy. At our agency, our surrogate compensation in Texas starts at $45,000 for someone who has insurance covering the surrogacy. What that means is you'll be able to take her insurance and use that to cover the medical expenses of the child while she's being, carried by the surrogate. Once the baby is born and the cord is cut, all of those expenses would end up on your insurance. So there's really a lot of factors to consider. Other states where there's not as strong of a demand for surrogates, the compensation goes down a little bit. And places like California, where there's an incredible amount of demand, especially from overseas, you're going to see compensation $50,000 and up for a first-time surrogate. So again, there's so many factors. It's really varied, but again, everyone kind of is in that general bucket of all costs around 125 to 145, depending on the choices you make.
Great. And again, I'll direct you to, if you want a little bit more detail on this, to go to our chapter on the cost of surrogacy on our website, gazewithkids.com. We go into a little bit more detail there. And again, we have another webinar that's going to come up that's going to go into all of this in a lot more detail. Okay, so the next question is a great one as well about the risks or lack thereof or level of success if eggs are frozen. I think we can add embryos and sperm to that as well to be used at a later time. Dr. Goldstein, do you want to take that?
I would say that the gold standard is creating embryos, and the success rates are higher when you create embryos as opposed to when you have eggs that are frozen. There's probably about a 5 to 8% reduction in terms of success when you're using frozen eggs. We certainly have had frozen eggs that we've had in our clinic that we've used, and we've had good success with that. But I think that you get more information when you have an embryo. So unless there's a specific reason of why, for example, you'd want to do that, you really would want to ideally. You really want to create embryos initially because you're able to get information such as whether they're chromosomally normal. When you have eggs, you're not able to really get that ready to get that information. But it is becoming more common, I would say, to have frozen eggs. But I would say the majority of the patients that go through really create embryos.
Great. And so at the same time, we have another question down here about pre-implantation genetic testing and whether that's safe for the embryo or if that's ever potential to damage it.
So that's actually a very good question. When we used to do pre-implantation genetic testing, we used to do it on day 3 of the embryo development, where there's a 5 to 8 cell embryo. So you're taking one out of 8 cells to test, or that's what we used to do. And now actually we allow the embryos to grow to day 5, where there's hundreds and hundreds of cells. And so you're taking only a very few amount of cells to test. And so by and large, if you go to a center that has a lot of experience, probably 80 to 90% of the IVF cases that we do now are involving pre-implantation genetic testing. If you go to a center that has really a lot of experience doing that really there's no the effect or the risk of damage to the embryo is very minimal, and the outcomes are no different than patients that are not having the testing. So I think it's becoming definitely much more of a standard in terms of doing that.
Great. Okay, so we have a great question about international intended parents. This particular question is from someone in Europe. And can you just talk, we'll have you both answer from your perspectives what the experience is like if you're working with someone abroad. Kristen, you want to take that first?
Yeah, no problem. So I'm guessing if you're on this webinar, you speak English. So that's the first factor, is if you speak English or if you're going to need to have a translator involved throughout the process. So if you're understanding this and you speak English, then that's great. That's one less person that you need to have involved in the process. But of course, we have worked with many people who do not speak any English. So if that's the case, then we can also help you out. Generally, the process is about the same, except for obviously right now we're seeing limitations on people coming in from other countries. So we're hoping that will be eased into 2021. So by the time your baby would be arriving, those restrictions would be eased. But right now, what we're having to do is we're having to write people letters, and people are having to take more months to spend time here because the passport agencies were closed. And so that was really the main complication for international parents right now, is taking the time to write them letters, to get them into the country, putting them up at longer term places to make sure that they're going to be able to be here when the baby is born, and then them just waiting out the passport agencies reopening. That's the main factor. The other factor to consider is you want to make sure your agency has experience in the country where they're going to be bringing the baby back to, because a lot of those countries have different laws and different regulations in terms of the process that needs to happen with bringing the child back. So we work with many different countries and international attorneys, and we can refer you to an attorney in the country that we've worked with. We probably worked in your country, and you want to speak to that attorney before you bring the child back to make sure you've got all of your legal process lined up to make that child a citizen of your country. Because you can go back on a U.S. passport, your child will always be a U.S. citizen, but to get citizenship in your country is something that you usually need a local attorney to help you with.
Fantastic. And we had another question that was specific to that about someone living in Chile, or from Chile living in Canada. So hopefully that answered your question too, Daniel. Let us know if it did not. So the next one is, I'm sorry, did you have anything to add to that, Dr. Goldstein, about the process?
I actually saw 2 guys last week actually from Germany. And so, believe it, there are flights that are, Dallas has direct flights to major cities. And so it seems like that things are starting back to where they were, before, at least on the road to that. And, they came in, 2 days before, and we saw them, and basically we're spending some time in Dallas, and then we'll go back. So I think that it really is, is pretty similar to someone that lives here in the States for the most part, except for the part that Kristen talked about in terms of making sure that everything's taken care of in terms of the surrogate and delivering the child and things like that.
Great. So we have 4 minutes left. We have a couple more questions. Let's see if we can get through them. But this is a great question about funding IVF and surrogacy. Do institutions offer any loans for this journey or grants or things of that nature? Do you want to take that first, Dr. Goldstein?
Yeah.
Oh, sorry. So go ahead.
I jumped in. I was so excited. Yes, there are lots of places that you can get some financial assistance. If you go to our website, we've got a list of different programs. There's at least 5 or 6 different companies that specialize in fertility loans and financing to help you get your way through the IVF journey. I would also really encourage you to speak to your employer and look into your benefits packet, because we've seen a huge uptick in people having benefits through their companies, especially if you work at one of the larger, more current companies. They're having, we've got some intended parents where both men will will have benefits through their company. And we've seen a lot of money come in through that, like sometimes $20,000 for each intended father. So definitely start there. And if if your company does not have a program, go to them and ask, I would say, because we're seeing a lot of people just go and ask and get benefits that way. So I would say start with your company and look at our website. There's a list of different financial places that you can apply through that, you don't have to use our agency for. We've just got a list out there for resources. And then I would also say that if you are looking for grants and things like that, the Men Having Babies program is really great. We participate with them both as pro bono, and we give unlimited a number of discounts through their program. So that's a really good resource. I think they even have a membership that you can join. I think it's maybe less than $200 for their membership. And we also give discounts for that. And a lot of people have reciprocal discounts through them.
Great. I'll just add once again to definitely join our webinar in a couple weeks on affording surrogacy. We'll go into all of that in a lot more detail. Anything you'd add, Dr. Goldstein?
No, I think that as a fertility clinic, we're interested in building families, and we really try to help you through the process. We have financial counselors that are able to look at your benefits and make sure that that you're able to take advantage of coverage that you have to cover the fertility part, and then and hopefully make the process possible. So so that doesn't have to be a barrier for you having a baby.
Fantastic. Okay. So the last question we'll probably have time for is, Kristen, could you talk about the differences between using an egg donor and an egg bank, or just the different egg sources, I guess you could say?
Definitely. Yeah, so we do see people using egg banks, and we do sometimes see shared cycles for egg retrieval. So if two people like the same donor, they can do a split cycle or shared cycle. Again, you'd not want to have someone like Dr. Goldstein really check and make sure they have the egg quality before you enter into that kind of agreement. But generally speaking, it is less costly to use an egg bank, but sometimes the quality is not there. And we have had a couple of cases lately where people have thought they were going to save a lot of money by using an egg bank, and then for some reason none of the egg quality was not there when they got to the clinic. So we often recommend getting the guarantee. A lot of these egg programs offer a guarantee if you're going through their bank, so definitely look into that and definitely consider that. The one benefit to using an egg donor is, especially if you're looking at a sibling journey, that you have a lot of eggs. If you use an egg donor, you get all the eggs. And with an egg bank, you're really just signing up for like 6 eggs as an example. Sometimes it's even fewer than that. And so they really only gets you 3 transfers of 2 embryos if you're doing 2 embryo transfers. So if it took you a few tries, you could run out of eggs and have to pay again for them. So the benefit of an egg donor is you get all of the embryos that are created from that egg donation. So that can be a better use of your money if you're going to go about it that way.
Great. Anything from the clinic side, Dr. Goldstein?
Well, I would say certainly the other issue is that if you're planning on doing split insemination, within really trying to use an egg bank makes it not really a practical way of going about doing that. And the second thing is that when you use an egg bank, you need to find out where those eggs are coming from. A lot of times there's a variety of different clinics that are in that egg bank association, and they can have different success rates. And so we have found that most people use an egg donor because in the long run, it turns out being cheaper and resulting in a baby. So that would be, again, we really, we want you to get through the process in the least amount of time and having a baby. And I would say the same thing, if it's a family member, I would say really strongly consider using an egg donor, because I know that that's really, 75% of the time makes a baby.
Great. Fantastic. Okay. So that is all we have time for. If we did not get your question, I'm sorry. Please do email us at dads@gaysweekkids.com. We'll make sure that we get our experts to answer your questions as quickly as possible. Also, if you would like to get in touch with Kristen or Dr. Goldstein directly, please feel free to contact us and we'll make sure that we connect you. I also just want to do one last shout out for our webinar series. This is the second in a series. We'll be doing these about weekly. They'll touch on every topic imaginable as it relates to queer fatherhood. We have a lot of these that are going to be focused on adoption and foster care. So if you're exploring those options too as a path to build your family, a lot of great stuff coming up there as well. And then please do check out our new resource center on gayswithkids.com. We have videos and curriculum series that involve all of our experts and goes into a lot of depth on all of these issues. So please do check out our upcoming webinar series, and we hope to see you at a future one. And I can't thank our experts enough. Kristen Hanson of Simple Surrogacy and Dr. Goldstein of Fertility Experts of Texas, thank you so much for being here and for your expertise. And please stay tuned for more from Gays with Kids. Good to see everyone. Thank you for joining us, and hope to see you at a future webinar soon.